Funding for the opioid epidemic, seeking solutions in North Dakota, is provided by Blue Cross Blue Shield North Dakota Caring Foundation, bettering the health and well-being of North Dakotans and their communities. Bell Bank, Dakota Medical Foundation, and the members of Prairie Public.
The problem is staggering. The system is overwhelmed.
I'm not an addict. Of course I was.
This is an all-hands-on-deck problem.
People are dying. Enough is enough.
Once you've had that experience, you've had that experience. You never unknow the effect that an opiate had on you.
If you think this can't happen to you or your family, it's a naive thought. We probably didn't think it could happen to us, but it certainly did.
I hear people say, oh, it's another dead junkie. That's someone's child. That's not okay. I don't want to live in a world where people are dispensable.
The opioid epidemic, specifically misuse of pain medications including hydrocodone, oxycodone, and others, has gripped the nation and now grips North Dakota. Deadly opiates like fentanyl and heroin have resulted in overdose deaths, which have tripled in North Dakota in recent years. Arrests and crimes related to opiates are on the rise, and health professionals and counselors are fighting a tough battle.
Originally, it was opiates, which came from the opium poppy seed from Afghanistan primarily, and that was the term that was used. Since then, there's the term opioids, which are relative to opiates. So what we're talking about is heroin, morphine, and some of the prescription medications that you hear about, hydrocodone, oxycodone.
All of those drugs act in a similar way in the brain in several places. One of the things that opioids do is to block pain receptors, and that's how we started using opioids to treat pain. But they also actually operate in what we call the reward centers or pleasure centers, and so some people are particularly vulnerable to feeling a great deal of euphoria and pleasure when they take opioids. Kids can literally experiment with this once and die.
Experts say people get addicted in a variety of ways, from kids starting with pot and alcohol, eventually leading to opiate addiction, to ordinary people who get in accidents prescribed powerful pain meds. Most only need the pain meds for a short time, but others become addicted and desperate.
Addiction surprises all of us in terms of what it causes people to do. Everyday people, regular people, just like all of us. And physicians do find often surprises about what their patients are doing that doesn't involve them.
And there's plenty of blame to go around when looking back to the origin of the problem.
The medical community certainly has a role, both in terms of what's been going on, but the solutions. And part of the reason we got here was years ago, the medical community was essentially criticized for not managing non-cancer pain. So you see the little round smiley faces in every office that says, how is your pain today? Rate your pain. So eventually we got into the habit of prescribing, and probably prescribing more than people needed.
We can go a long way back in finding blame. We can look at a culture that wants to be pain-free, and nobody promised a pain-free life. We are Americans, and we want it right now when we want it. We want to be pain-free right now. Things that change our habits or require lifestyle changes are really challenging for us. And sometimes the management of pain, kind of like obesity or changing diet, those are hard work. So if there's an easier answer, we tend to default to that. And so I think there was a time when opioids were seen as a sort of an easier answer.
Are you or a loved one struggling with addiction? Pay careful attention to these signs: medications missing, indifference and lack of engagement, dramatic mood change, falling in and out of sleep, and change in friends and unusual risk-taking.
Some of the prescription drugs we see on the street are hydrocodone, oxycodone, Vicodin, those types of drugs. And then the illicit drugs we're seeing on the street in the opioid class are heroin, fentanyl, and then carfentanil. A small amount of fentanyl, like the amount on a tip of a ballpoint pen, can kill some users. Fentanyl is 50 to 100 times more potent than morphine, and then carfentanil is 100 times more potent than fentanyl.
They surveyed the district court judges, and 70% of the district court judges indicated that they sent low-risk, nonviolent people into the Department of Corrections prisons just to access a treatment program. There are people that come to prison that need to be in prison that are addicts, but there are people that are coming to prison only because they are addicts, and there's not a continuum of care readily available in the state, and that needs to increase, and I think there's some efforts to increase it, but frankly, we're behind the curve. About 80% of everyone coming into prison has a drug or alcohol issue. Over the last couple years, we've seen a significant increase. It used to be fairly rare that we saw IV drug users coming into prison. And now in our adult females, IV drug users is up to 45%. Punishing people, the sheer punishment proponent, which is really why people get incarcerated, doesn't keep people sober.
The legislature passed a bill called Justice Reinvestment, and that $7 million will be diverted towards people that are going to be incarcerated, diverted for treatment instead of incarceration. And then that program will be outcome-based, meaning paying for wellness, paying for getting back into society.
Be responsible with your medication. Lock, monitor, take back. Drop off unused medication at local take-back locations. They are widely available at pharmacies and law enforcement locations.
The gold standard, or what we think of as the treatment that has the best evidence in targeting opioid use disorders, is the combination of what is called medication-assisted treatment and psychosocial treatment with treatment and recovery support services.
Treating the opioid addict is multifaceted. Some facilities favor abstinence only, but the withdrawals can be horrifying, described as having influenza for 2 weeks, but much worse.
With opiates, people get blindsided by them because they start out getting them prescribed, or they start out and it's just fun. They have no idea what they're getting into, and all of a sudden they don't have it, and then their body aches for it, and every cell in their body wants it. That includes their legs. They get this restless leg and they can't sleep and they're depressed and they sweat and they chill, and then they use again and that feeling goes away.
Currently, there are 3 prescribed forms of medication-assisted treatment that can reduce cravings and help the addict.
One is methadone, which everyone has heard of, and that requires a special clinic and usually daily liquid dispensing. Methadone has the best evidence by far of treatment for opioid use disorders. The next replacement therapy is buprenorphine. That requires a waiver and training by either a physician, and now a PA or an advanced practice registered nurse can prescribe. And that's clinic-based. And so that has allowed people to not have to go necessarily to a methadone clinic, but maybe more flexibility. The last one is essentially a blockade of opioid use, and that's naltrexone. It was initially approved for alcohol use in a daily pill form, and now it's approved for both opioid use disorders and alcohol use in a monthly injection as well.
If we had the options available for cancer that we have available for addiction, and we did not make them available through insurance, or we did not make them available through our health systems, we would have an uproar.
There are medications that are available that help. They are evidence-based, they are FDA approved, they are effective. What I tell my patients is, as long as you're compliant with the program and what I expect from you, you can stay on these medications as long as you feel you need to. I do have patients that have been on these medicines for 6.5 years with me. They're doing great.
People get well, families get well, the definition of well can change. Recovery lifestyle is an amazing lifestyle.
Medical providers, you can help prevent opioid misuse and overdose when prescribing and monitoring opioid treatment for your patients. Have you considered getting involved as a much-needed medication-assisted treatment provider?
Show me how you can bounce that ball. Okay, ready? I was actually laying right here on the floor with a 6-month-old baby, and I told myself that day, I said, I'm either gonna die right now or I'm gonna get some help. Normally I would drink when I was 12, with friends. Friday, Saturday night, we'd try to find somebody who had a couple beers. That's how it started, and it was just normal, I thought. But at 12, I was sexually assaulted, and my mom and dad gave me some pain medication, and I loved it. A lot of my early teen years are a real blur. I went to counseling to try to figure some of that out, but at this point, I don't think I want to remember. I had 3 kids from 16 to 19, and then I got divorced. I missed partying. I missed having fun. At 22 was my first time in prison. I went to prison for stealing checks, writing them to get money to use. I went to treatment in prison, was in there for about 2.5 years, clean. It lasted about a week when I got out. Fentanyl scared me. I watched somebody overdose in front of my eyes. So fentanyl scared me, but only to the point that I was a little more cautious when using it. Still used it. Heroin was harder to get a few years ago, I think, than it is now. I would definitely use it if I could find it, but opiates were definitely my drug of choice. I was in a coma for a few days. They told my mom and dad to plan my funeral. I don't remember a whole lot of it, but I remember going home with they put a port in my heart so I could have IVs, antibiotics after I left. And my first thought when I was leaving was, I don't have to search for a vein anymore. I was prostituting myself out there to find drugs at this point, and I got pregnant. And that's when I heard about Suboxone. I called Heartview, and unfortunately they said, we don't have any openings. We can get you in a couple weeks. And I hung up the phone completely defeated and ready to just give up. They called back 5 minutes later and said, can you come in right now? And I did. After I got out of treatment and completed aftercare, I had been clean and sober about 6 months before I actually had a court hearing. And at that court hearing, looking at my record, they sentenced me to 3 years. I wanted to give up again, but I didn't. I really wanted it. I went to prison, I went to a halfway house afterwards, and I went right back to Heartview the day I got out. She is the love of my life. I'll never forget looking at her on this floor when I didn't know if I was going to go in the bathroom and kill myself, because she deserved better. She didn't deserve a mother who couldn't take care of her, who loved drugs more than I loved her. She deserved a mom. Just because I went to treatment and I got clean and sober, you still have cravings. I'm an addict. Suboxone takes away the cravings. It actually helps my thought process. It helps me feel normal. I do have contact with all of them. We have a good relationship, but not the relationship that I would have had I raised them and been close to them. Heartview Foundation, this is Shyla. Can I help you? Every phone call I take, I wonder if he doesn't get in or she doesn't get in, are they going to be the next one? It's the hardest part of my job, is saying I don't have an opening right now. There's help out there, but there's not enough. There's not enough treatment centers, there's not enough doctors, there's not enough knowledge. I'm seeing people get well, and that's amazing.
Addiction is a disease. Helping sufferers is not a competition between treatment, medication, or recovery. Our response should be rooted in science and tailored to individual needs.
He was really good on these short reed goose calls.
We thought we had a pretty normal family. We were home every night. We went to all their activities. He was a good boy. He was a straight-A student. He was a great athlete, fantastic outdoorsman. But you could just see it all just slowly slipping away.
We think Matthew was around 14 when he started using. He liked to smoke pot. Marijuana really was his drug of choice for a long time, and then he got involved in other things. I know he used painkillers, but he said, well, that wasn't my thing. And he did have a friend of his who they don't really know what happened, but they found him dead. So then he kind of quit the painkillers.
We'd get him in treatment, we'd get him cleaned up, and he'd be fine. He'd be okay. And then he'd go right back to it, and you could just tell within a day or two when he was back using, his whole persona changed. It was such a devastating thing to watch him just wither away and give up everything that he formerly loved and did.
He was in and out of treatment all through high school. He ended up graduating high school in jail.
He had been really sick the last couple years with the psychosis. We'd get him better, but then he'd go right back on it. And one of his doctors told him, I can't beat anything that you can get on the street. That stuff's going to win every time. We sat in this room with him all summer and all fall, probably the year or two before, and he'd hear these voices. They would say, you're a loser, kill yourself. You know, no one loves you. To him, they were real.
We both talked about how it was almost we were fighting a supernatural force, and no matter what we did, it had such a grip on him.
He came up inebriated, and I'm sure he was loaded, and he wanted to go fishing in the middle of the night. It was the opening of the muskie season. It was a cold, rainy night, and he was not in good shape, and we said, no, you can't do that. It's not safe. I got up in the morning early and I found him.
He took his own life. What we have over this past year, you come to grips with what happened, but also now how do we live?
I think the problem was he started so young. Your brain isn't fully developed then. He looked at things many times as an adolescent, not as a 24-year-old. Did we make mistakes? I'm sure we did. Mm-hmm. We tried everything we thought we could, and it seemed like no matter what we did, we just kept running up against a brick wall. I think about Matthew all the time. I think about him at work, when I'm doing all the things that he loved to do, and the shadows come out at night, where you'll wake up and have I have that vision of when I found him. I know I didn't sleep for 3 months very well after that. It's gotten a little better, but the thing that gets me through my day and my minute and my second is I know he's in a better place now. He's not suffering anymore. I needed to do something at the lake where I found him. So we built a shrine there to the Virgin Mary.
There needs to be more education for parents, because with those middle school, those kids in that age group, you want them not to even try it.
They're my kids and your kids. They're kids that live in our community, and we don't want to lose any of them.
We did a lot of praying throughout
we still
the time,
do.
Throughout the 10, 12 years, and many times I'd say, I don't think our prayers are being answered. But in the end, we realized they were, because Matthew would come home safe. I just picture him in God's arms now.
I still want to, take care of him. But somebody else has to take care of him now. And I know they'll do a better job than I did.
Even if opioid use doesn't touch your life or loved ones directly, there are ways to be part of the solutions. Many charities statewide are helping to raise awareness and resources to fight addiction. Visit impactgiveback.org.
The sad reality of this is that more of us die than make it. I've been to countless funerals in the last 7 years, and I'm going to keep going to them. Those are my friends, those are my family, the people that are out there dying from this disease. They truly are wonderful people who just don't know any other way to get through a day. The first drug that I ever did was definitely alcohol, and that was at 13. And it became something that I realized pretty quickly that when I was under the influence, things were just a lot better in my head and in my mind. And I spent 3 years of my life living on the streets of Minneapolis. I did all those things that you see on TV, you hear about. I would sleep in dumpsters. There's a gas station on Lyndale that I knew that they threw their breakfast food away at 10:30. That's how I would eat. And I did whatever I had to do to survive, but mostly to get high. My toe was broken. So I go to the doctor and they gave me hydrocodone. That was my first experience with painkillers, with any kind of opiate. My first experience with hydrocodone was, hey, this is awesome. It's pretty similar. You know, it wasn't quite the same as meth, but you know, it gave me something, and what it gave me was an escape from reality. It gave me the ability to feel okay and just get through a day. And from that moment on, oh my God, everything was crazy. I could quite easily go into the doctor and say I had a toothache, and they would give me more hydrocodone. And I had been doing that for quite some time with no consequences or anything. They just kept giving them to me. I heard about something called Suboxone, and I didn't really know much about it, but from what I was told from people, they said it stops you from going through withdrawal. And I was like, great, where do I, sign me up? What it did for me was it gave me the ability to wake up every day. I took my medication and I went about my day. I went to my meetings, I met my sponsor, I did all those things I was supposed to do. I went to work, and my life started to change. I didn't even really realize until much later how lucky I was, how amazingly lucky I was to be that rare person that was able to take it. And it's only because of the work I was doing on myself that gave me the ability to be successful on that program. But Suboxone did that for me. I started off on 2 a day, and over time, I went to my doctor and I said, I want to get off of this. If you are on it for the rest of your life, but your life is okay, then that's for you to say. And I'd rather see somebody take Suboxone every day for the rest of their life and have a life than not. I'll have 7 years clean, so I've been doing this for some time. Over the years, my mom, she's the person I'm closest to, and, I had lied to her so much and hurt her so much. And I now look back and I don't blame her for not trusting me. One of the things that I'm grateful for is every single second that I've suffered, because it gives me the ability to look another addict in the eye and say, I understand, you're not a piece of crap. You're just trying to get through a day. It doesn't excuse the things that we do, but it is a reason. We don't just wake up and say, God, I'd love to get fired today. Only another addict can really understand that. I do a lot of speaking and stuff like that, and I always say, my life today is nowhere near perfect, but it's just normal. I have my dog, I have my comic books, I have my passions and my hobbies. I go to meetings, I work on myself with my sponsor, I have people that I sponsor. My life today, it's not perfect, but it's the best it's ever been. Just don't give up, keep searching. If you keep looking, you're gonna find it, the thing that will save you.
Treatment works. Reach out, get help, find hope. Find free addiction information, resources, and assistance at prevention.nd.gov/stop-overdose by calling 211 or by reaching out to your local public health unit.
There is no one solution. And I think it's really important for everyone to acknowledge that, and that we all have a part.
Healthcare entities have really looked at their prescribers and giving less after surgery, not giving a whole month's worth, just a few days worth, and then call back.
Oftentimes, politicians want a quick fix and that quick press conference. That's not the issue we're dealing with here. This is going to be a marathon to try to change the amount of treatment, the length of treatment, to make a difference in our communities.
We can destigmatize the language around addiction, and so that families openly can talk about what it's doing to their families and openly seek help and support. They need to go back into a supportive community that actually helps them in their recovery and not pushes them back into their usage.
The addicts do not want to be addicts. And path to addiction, there's many stories out there. But the earlier these kids start this, it's really a tough road.
I have seen so many people get better and they become amazing human beings and families become functional. We need to talk about what it has done to family systems to build a healthy family lifestyle. People get well, families get well, families can be well even if addiction never ends. It's a disease that has to be attended forever, but people can get well.
We all have a role. Together, we will make a difference. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Margaret Mead.
Funding for the opioid epidemic, Seeking Solutions in North Dakota, is provided by Blue Cross Blue Shield North Dakota Caring Foundation, bettering the health and well-being of North Dakotans and their communities. Bell Bank, Dakota Medical Foundation, and the members of Prairie Public.